Welcome back on the program.
Right, thank you for staying with us. To our first conversation for today, over the past decade, Nigeria has seen major attempts to strengthen primary health care, including the Saving 1 Million Lives initiatives, improving on the National Health Act, among many others. In a significant move to improve the health and well-being of Nigeria's youth, there is a need to address critical issues like mental health, accessibility to quality health care, among others. According to the Minister of Youth Development, Ayodele Olawande, this new investment will align with Nigeria's national health guidelines and the standards set by the World Health Organization in ensuring a comprehensive approach to advancing youth health and well-being. But joining us via Zoom from Abuja for this conversation is the newly appointed Senior Special Assistant on Youth Adolescent Health, Dr. Obinna Ibrahim. Good morning, and thank you for joining us on TVC Breakfast.
Good morning. It's my pleasure to be here today.
Right, let's begin with the major health concerns affecting young youth and adolescents in Nigeria. We've seen a spike in health concerns in recent months. Talk to us about this and how well have we fared in addressing them?
So thank you so much. As you know, President Bola Ahmed Tinubu is a president that loves young people, and he's focused on creating the enabling environment for young people to thrive. Now, young people are faced with a lot of health issues, such as you rightly said, mental health, substance abuse, infectious diseases like STIs, HIV, and even HPV causing herpes and cervical cancer. We're also seeing young people with non-communicable diseases like obesity, even cardiovascular diseases. So young people are faced with a lot of problems health-wise, and the Minister of Youth Development, Comrade Olawande Ayodele, is approaching the effort to ensure national youth development from a holistic approach. So he understands that even with all the good efforts and activities he's putting in place, like the National Youth Investment Fund, the Co-Entrepreneurial Initiative, the Green Initiative, the Youth House, the support to empower young people, that young people need to have good health and well-being to be able to enjoy and maximize those opportunities. So that is why he's has this focus in improving and addressing and prioritizing the health and well-being of young people in Nigeria. Now, I can give you an example. So a good example is with the loans and facilities and grants that will be provided to young people. Imagine a young person has this grant and is supposed to use it to advance his business and all that. If that young person is involved in substance abuse, you might end up seeing that the young person will use that resource instead of for the good, what would be of benefit to him or her, but he will then use it for maybe acquiring drugs and all that. End of the day, his or her life is not better off. So in trying to ensure youth development, creating an enabling environment for young people, it's also important to address their health and well-being.
Dr. Obinna, creating a good environment for the young people is quite interesting at this time. How can these young ones get connected to some of these grants that you mentioned?
So if you go to their website, they're out there, and as just a few days ago, the Honorable Minister was on the TV, and their message is out there where young people can go to. So, for example, the National Youth Investment Fund, the website, it's up there. You don't have to know anybody. All you need to do is just go online and apply. And as the minister mentioned the other day, there's going to be a revetting process to ensure that those who are qualified to get these funds are getting these funds. So it's out there, it's free. As you know, it's not like in the past where you need to know someone to get those facilities. All you need to do is to go and apply. And I can assure you that for those listening to me today, if you search for Nigerian Youth Investment Fund, you will see the website. The website is working, you can apply. And that then puts you in equal opportunity to every young person who has applied to get that grant.
And one of the major concerns in addressing or accessing health, equipment, healthcare, and all of that is funding, insurance. What's your office going to do in terms of, bringing healthcare closer to Nigerian youth, even if, especially for, illnesses or diseases that they will not likely want to speak up about, stigmatization and all of that?
So this is an area that the Honorable Minister is interested. So the Honorable Minister is interested in, one, supporting young people, empowering them, and protecting them. And one of the activities under empowering young people is that he's beginning to now have conversation with the Ministry of Health and and then that will translate to also discussion with the health insurance agency authority to see how can we cover more young people. There's an effort to ensure that we increase the insurance coverage in Nigeria. And one of the questions is there are some young people that can be covered. So one of the questions we are asking and we are deliberating and brainstorming at the moment is members of the Youth Service Corps, they are serving the country. Can they be added to the vulnerable pool that are covered by government, the under 5 that are covered by government? And these are some conversations that are ongoing. So I want to assure you that the Honorable Minister is interested in preventing the financial catastrophe and unintended expenditure associated with health care among young people. And he is exploring ways to protect young people from financial risks associated to health by seeing how young people can be accommodated in the health insurance pool. And by so doing, young people will then be able to go to health facilities to assess. But this is a conversation that is ongoing, and this and other activities. And then beyond health insurance, conversations with health insurance authority, it's also other programs. So one of the things the Honorable Minister is doing is to also interact and collaborate with development organizations to see how we can how funds can be attracted for programs that benefit young people. And in the coming weeks and months, you'll begin to see some of those programs that tries to address issues around mental health, around substance abuse, around the non-communicable diseases that affect young people. So you're going to see those programs, and all that also increases the pool of funds available for health of young people and adolescents.
Dr. Obina, let me quickly bring you up to speed concerning your own personal message on expectations for year 2025 concerning the health sector. You said in that message that reduce out-of-pocket expenditures and also bring progress in equity and access to healthcare services. What do you make of all of the development on your expectations in the health sector for the year 2025?
So yes, so one of the ways to reduce out-of-pocket expenditure is ensuring you're increasing the health insurance coverage. So it means that more people are added to the health insurance pool. So when they are ill, they don't have to spend out of their pocket. The monthly payments that have been done for them or by them would now cover their health expense at that point. So that's one way. And as I mentioned earlier on, this is also something we are brainstorming and discussing and thinking about in the Ministry of Health, Ministry of Youth Development, to see how can we cover more young people. Are there young people that fall into a particular group that can fall that can be covered by government, or are there ways we can find innovative insurance schemes that help cover young people? So that is one way. And then also increasing access. Really, one of the ways we would achieve that in terms of young people and adolescents in Nigeria is we will be now involved in advocacy and also policy reviews to ensure that the health and well-being of young people are prioritized. So every conversation around health will be intentional to ensure that those health issues that affect young people are put on the front burner and they are prioritized.
Dr. Obima, let me quickly jump in at the moment. So what are your expectations in this new position that you occupy? What are those things Nigerians should be expecting from you?
So 4 things. I call it READ, read. So it's raising awareness on health issues that affect young people. It's empowering young people to take ownership of their health and seek health care. It's advocacy for both policy and behavioral change that will improve the health and well-being of Nigeria, of young people. And the final one is develop and implement programs that improve the health and well-being of young people. So those are the 4 key priority areas that I'll be supporting the Honorable Minister, and we're working together to ensure that the health and well-being of young people are prioritized, and they can then be in a good frame of mind.
We just have to go now. Apologies for that. Senior Special Assistant to the Minister of Youth Development, Dr. Obina Ibrahim. Many thanks for joining us on the program this morning.
Thank you so much for having me.